Hello, good morning. It's me again, Tito. Today I would like to continue with the previous lectures on poultry pathology. Last week we already learned about many kinds of disease caused by mycotoxicosis. For today I would like to continue to other mycotoxins, is the ochratoxins, and then the main topic of today's lecture is about pasteurellosis disease, or we call it as full cholera, and other kind of pasteurellosis that usually occur in ducks. We call it the anapestivir infections. Okay, so ochratoxins. Ochratoxin itself consisted of many kinds of ochratoxins. First is ochratoxin A, B, C, and D, but usually that we found and the most toxic is ochratoxin A. Ochratoxins made or synthesized by a mold, particularly the Aspergillus and Penicillium mold, and we can find amounts of ochratoxins in the feed constituents, for examples like maize, corn, or ground nuts. Therefore, the contaminants of ochratoxins mainly can be detected in the feed constituents and feed itself. For examples, one of the mold that producing ochratoxin is Penicillium viridicatum. Penicillium viridicatum producing mycotoxins, producing ochratoxins at 4 degrees Celsius, and the moisture of affected grain around 18.5 until 40%. So ochratoxins, this is the chemical uh, structures of the ochratoxins, and ochratoxins can affect human and also animals, all kinds of animals, and the amount or concentrations of aflatoxin in feed, for example, around 2 until 8 ppm, okay, remember ppm part per million, can cause intestinal damage in chicken, and lower concentration, about 0.2 ppm, causing nephropathy in pigs. Nephropathy means kidney damage with minimum inflammations. And then 1 to 2.7 ppm of aflatoxin is highly toxic for pigs. And the ochratoxin can work synergistically with other mycotoxins, for example, with aflatoxin and citrinin. So if there is other contaminant, if there are other contaminants from aflatoxins or other mycotoxins, it will make the severity of ochratoxicosis and also the severity of other mycotoxin intoxications will be more severe. So chicken, turkey, Japanese quail, rat, and mouse can be affected by oral intoxications of aflatoxins. You can see here the chicken is the most susceptible animal to ochratoxins, and mammals like rat and mouse they are more resistant to ochratoxins. You can see here the amounts of ochratoxin that can cause damage in mammals like rat and mouse is much higher concentrations compared with poultry. Ochratoxins can act as inhibitor of protein synthesis, and they have competitions with amino acid like phenylalanine. As you know that the proteins and also phenylalanine is important to build a antibody structures. For example, fragment AB fragment or FC fragments of antibody made from many amino acid. Due to the inhibitor properties of ochratoxins, the process of making antibody will be diminished. Therefore, the animal will have low amount of antibodies that indicating immunosuppressions. The effects of ochratoxins in the immune system of poultry, it can be inhibitions of humoral, cellular, and innate immune response. In particular, this humoral, cellular, and innate immune response caused by inhibitory properties of uh, protein synthesis due to ochratoxin intoxications. Therefore, because the uh, protein synthesis will be diminished or will be lower, therefore the mitosis of many lymphoid cells like lymphocytes or monocytes cannot be done properly. Therefore, there will be cellular depletions of lymphoid organs. Lack of antibodies make some response that initiate by leukocytes, for example, hypersensitivity response or the phagocytic activities will also be lower compared with the normal one. Therefore, if there is immunosuppression, the animal will have increased susceptibility to infectious agents. Okay, and then because the lymphoid cells or leukocytes cannot be grow or cannot be divided well, therefore there will be lower amount of leukocytes that we call as leukopenia. Lower amount of leukocytes means also lower amount of monocytes, that makes the phagocytotic activities by leukocyte will be diminished as well. The grossly during necropsy, the pathology of acrotoxicosis is not so specific, but there will be decreased body weight and also decreased egg productions. And then there is also brittle bones that associated with arthritis. So due to arthritis, because of ochratoxicosis, there will be low absorptions of calcium that makes the building of bones will be impaired. Therefore, there will be fracture or brittle bone appearance. So, just like I mentioned before, high concentrations of ochratoxicosis can cause arthritis. However, these ochratoxins also can cause kidney damage that appears as a pale and enlarged kidney. In the chronic exposure to ochratoxicosis, there will be nephrosis and also, this one here, polycystic kidney and urease depositions in the ureter due to kidney function impairment. Histopathologically, we will find extensive tubular degeneration and necrosis of the kidney. If it's occur chronically, there will be fibrosis. Okay, and of course, because ochratoxin also can cause some intestinal damage, there will be arthritis due to epithelial necrosis. This arthritis also will be a spread to the liver and then causing also hepatic necrosis. Okay, so remember that the ochratoxins usually affect kidney, intestine, liver, okay, liver, and therefore the lesions almost similar with other mycotoxicosis like aflatoxicosis or fusarium toxin. However, in this case, ochratoxin also can cause arthritis or intestinal damage. This is the case of ochratoxicosis in the 24 days old broiler. This broiler also experiencing a dyspnea due to ascites. The main cause of ascites in this disease mainly due to extreme or extensive liver damage that causing low albumin productions. Low albumin productions causing a decreased osmotic plasma pressure that leads to uh, ascites or other kinds of edema. This is a dyspnea, okay, difficulty of breathing due to ochratoxicosis. It may caused by ascites or also pulmonary edema. In the case of ochratoxicosis, in particular, this case happened in geese. There will be uneven growth in the same age of animals. So this flock of geese, they have the same age, but individuals that affected by ochratoxins will will have more smaller size, or we call it as stunting. So there will be also enlarged abdomen in the goose affected by ochratoxicosis due to severe ascites. The younger goose will experiencing weakness. Okay, this weakness happens due to organ damage, due to multiple organ damage, multiple damage on intestine, kidney, liver. Okay, and also some edema that cause the general weakness in the individuals. So in the cases of chronic ochratoxicosis, there will be also hydropericardium due to hypoproteinemia. Okay, hypoproteinemia can be due to hepatic damage or inhibitions of protein synthesis. Okay, this one here, this is the ascitic fluid, okay, within the within the cavities or coelomic cavities of the goose. Okay, this one here, this is a miliary necrosis, multifocal necrosis in the surface in the liver. Okay, and if it's occur chronically, there will be also fibrosis. Perhaps in this case, if you see there, the structure of the liver is looks rough like this, maybe this indicate a fibrosis. And then in some severe cases of ochratoxicosis, the liver also covered by fibrinous material like this due to extreme ascites. Okay, this one here, this there is a hydropericardium. It means watery pericardiums, and also you can see a rough surface in the liver. Okay, that indicates a fibrosis. You can see here in the case of high contaminations of ochratoxicosis in a very short period. For example, here in 24 days old broiler, there will be fibrosis, liver fibrosis occur. This one here, this is the enlarged kidney due to nephropathy and acute nephrosis due to ochratoxicosis in chicken. Here you can see here and here. This one is enlarged kidney. And then histopathologically, there will be also shrunken or pycnotic nuclei. Okay, so in here, this is the normal nuclei. This is the normal nuclei. But you can see in some places, there are small or pycnotic or shrunken nuclei indicating necrosis. Beside necrosis, you can see also there is massive fecular degenerations or probably fatty liver, okay, due to ochratoxicosis. This case occur in the cases of acute ochratoxicosis. And then in kidney, you can find the hyaline or protein cast inside the lumens of tubulus. Okay, inside the lumen of tubulus, and you can see also some cells like this, just like I pointed here or here, affected by shrunken or pycnotic nuclei, indicating necrosis. So some practice and condition that can influence ochratoxin concentrations actually involving many stages in the production and processing chain. It can affect first in the harvest periods, storage, and processing. So the contaminations of ochratoxin can happen in all period of production. So the contamination can be found first in the harvesting periods and also storage period and processing. Therefore, regulation to control how to keep the feed constituents during harvesting and storage is very important, because we need to reduce the contaminations of ochratoxins in very low level. These are some fungi that also produce mycotoxins. For example, aflatoxin caused by productions of many aspergillus fungi, and this in the right column here you can see the toxicities. For example, aflatoxin causing a fatty liver, and it is a hepatocarcinogenic substance, and also other mycotoxins you can see here, citrofuridine, citrinin, and others. But the most important here, this one, aflatoxins and ochratoxins. There are also other mycotoxins that also very important in the practice. For examples like mycotoxin produced by fusarium toxins, okay, like trihortesins, deoxyphalenol, or zearalenone. We found many kinds of these mycotoxins in chickens and also other animals. For example, zearalenone is very important in the case of pig intoxication. So the pig can have a hyperestrogenic effects. For example, in the male pig, or in the male pig or a female pig, there will be enlargement of the reproductive organs due to estrogenic effect of this zearalenone. Okay. The mycotoxicosis severity can be due to the type of mycotoxins. For example, aflatoxin is more severe compared with other mycotoxin. And among the aflatoxin B1 is the most severe type. Okay, it can cause extensive damage in the liver, kidney, and also lymphoid organs. And then duration of dose. Higher dose will affect also the severity, and also longer durations will affect the severity. So durations also determines the lesions, whether it's acute or chronic lesions. And also age. Usually younger age will be more affected than the older age. And there's this also nutrition and health status. So animals with lower nutrition, for example, due to stunting, will be severely affected more by this mycotoxicosis. Or there is synergistic effect with other chemicals or mycotoxin. So for example, ochratoxin and aflatoxins will have synergistic effects if they mix together, that makes the severity of mycotoxin will be increased. And then the primary target organs, mainly in all of mycotoxins, they will affect liver and kidney. Okay, however, there are also some other mycotoxin which can affect lungs, nervous system, endocrine, and also immune systems. But in our experience, liver, kidney, and immune system are the most affected organs due to mycotoxicosis. So this all are the summary of the factors that can affect the mycotoxicosis severity. Okay, from the farm management, age, durations, nutritional, and also nature and level of mycotoxin concentrations. Okay, just remember here, level of mycotoxin concentration is very important, that causing the severity of mycotoxicosis. In here, these are the gizzard and proventriculus. Okay, this is all the gizzard and proventriculus. Gizzard that affected by Fusarium toxicity will experiencing what we call as gizzard ulcerations due to erosions. Okay, here. This one here, this is the normal one. This is the gizzard that affected with Fusarium toxins, with erosions or ulcerations. Here, if we look closely, the ulcers can cause extensive necrosis in the centers, okay, like this here. Okay, next I would like to describe about pasteurellosis. So pasteurellosis, called also as fall cholera. Fall cholera can happen in chicken and ducks, and actually in other avian species. And there is also one form of pasteurellosis that exclusively found only in ducks. We call it as the Remarella anatipestifer infections. So the cause of fall cholera is Pasteurella multocida. It's a gram-negative bacteria and it's bipolar. What it means with bipolar? Bipolar means if we look the structure of bacteria under light microscopes, and the slides already stained with some gram staining, for examples, you can see that in the some side of the bacteria, it's a coccus bacteria. One side or the periphery of the coccus will take more color. Okay, that's what we call as bipolar. Pasteurella multocida that cause disease in chicken usually has a capsule that categorized as type A capsules. It can be A1 or A4. Okay. The serotypes of Pasteurella multocida that can cause disease in chicken, it can be caused by serotypes with bacteria that has capsule of type A, B, D, E, then and F. Okay, so all these kinds of serotype can cause disease in chicken or avian species. However, they cannot cause disease in mammals. Okay, as you know that pasteurellosis also affect mammals. For example, cattle, small ruminants like goat or sheep, and also pigs. But usually in mammals, the serotypes caused by serotype O. So serotypes in chicken cannot infect mammals, and also vice versa. Although they are the same species, although they are the same Pasteurella multocida, but different serotypes. Therefore, co-infections between chicken to cattle or ruminants cannot be occur. And also because this is a gram-negative bacteria, they have also endotoxins in their membranes. We call it as LPS or lipopolysaccharides. The host of pasteurellosis in poultry can be found in turkey, duck, chicken, and other wild avian species. Route of infections mainly a horizontal route, so from birds to other birds, and chronically affected birds can act as the source of infections. And the pathogenicity of the lesions, okay, in pasteurellosis, mainly due to capsules and also endotoxins. It caused by lipopolysaccharides, okay, and also exotoxin produced by the bacteria. Usually this exotoxin produced by bacteria causing also damage in the tissue, because the bacteria use these exotoxins to invade the tissue. Okay, and then severity of pasteurellosis can be depend on animal species, age, serotype, and environment. For examples like Pasteurella annatipestifer or Rimerella annatipestifer only can happen in duck, okay, or other type of ducks, but cannot affect chicken. Okay, and then age, serotype, and also environments will also affect the severity of pasteurellosis. Stressed animals will be more affected by pasteurellosis compared with normal animals. Okay. The symptoms can be acute, peracute, or chronic. Peracute, it is asymptomatic, but the animal suddenly died. Or acute, in acute there is a diarrhea, dyspnea, or decreased feed consumptions. And the chronic cases of pasteurellosis, there will be many lesions. One of the most particular lesions that we usually found is swollen head, particularly around the sinuses and also in the comb and wattle. And then chronic pasteurellosis also can be seen in the form of arthritis and pad inflammation. We call it pododermatitis, and it can also causing torticollis due to inner ear infections or due to otitis. This is acute fall cholera with dyspnea. This is the similar chicken with dyspnea that affected by acute pasteurellosis. This one here is swollen head that usually occurs in the cases of chronic pasteurellosis. And then this is enlarged wattle due to edema and vasculitis. Okay, in the case of chronic cholera. This one also enlarged wattle with ulcerations. This ulceration is due to extensive vasculitis that leads to necrosis. Here, this one is swelling in the infraorbital sinuses due to pasteurellosis infections in the upper respiratory tracts. Okay, and this one is otitis. This kind of otitis can cause middle ear infection and also inner ear infections that leads to head tilt or torticollis. Here, the chronic form of fall cholera will exhibit a torticollis like this. These kinds of symptoms really similar with the cases of Newcastle disease, because both of these disease have torticollis as their clinical symptoms. However, in the case of Newcastle disease, the torticollis happen due to extensive damage in the cerebellum. However, in the case of the torticollis, in the case of pasteurellosis, the torticollis occur due to inner otitis, inner ear inflammations. In the necropsy, in the case of acute or peracute cases, we will find a general hyperemia. It means reddening of organs, okay, within the abdominal cavities and also respiratory tracts. And then we will find also pinpoint hemorrhages or petechial hemorrhages in the serosa, fatty tissue, and epicardiums. And the similar hemorrhages will be found also in the intestine, ovaries, and liver. And according to our experience, the most consistent lesion that can be found in the case of pasteurellosis is this one here, pneumonia. Okay, pneumonia, even in the cases of pasteurellosis in mammals, like in cattle, pigs, pneumonia also consistently found. Okay, and then because there are septicemia or sepsis in this case, the inflammations not only in particular organ like lung but also can spread into other organs, for example to liver, causing a miliary necrotic hepatitis. Okay, so miliary means a multifocal pinpoint necrosis in the liver. Miliary means multifocal, many foci of lesions, but if it's called miliary, it means a pinpoint, a very small focus of uh, damage. Okay, and in chronic cases, the pasteurellosis can appear as subcutaneous edema and also fibrinous pneumonia. Okay, just like I mentioned, the most consistent lesions that occur in the case of pasteurellosis, whether is it in poultry or in other animals, is here, pneumonia. But in the chronic cases, you will see more pronounced or more severe fibrinous type pneumonia. And also in the chronic cases, there will be otitis. This otitis leads to head tilt or torticollis. Here, this one is chronic cases of fall cholera. Okay, this one is occur in chicken and this one is in ducks, I think, with extensive sinusitis here, and also subcutaneous edema in the case of chronic pasteurellosis. Okay, you can see there is a fluid accumulations just under the skin. And this one here is the sinuses inflammations and also wattle inflammation. So you can see here the wattle inflammation. In the wattle, if we cut the wattle and we look the inner part of the wattle, there will be a fibrinous exudates and also accompanying with edema. Therefore, because there is edema and fibrinous exudate, the wattle will be enlarged. And in the cases of chronic pasteurellosis, there will be also caseous or cheesy exudate within the infraorbital sinuses and also surrounding tissue with hyperemia and also edema. You can see a glassy appearance here. This may indicate edema in the sinuses. This one also similar cases or cheesy exudate in the sinuses of turkey. Okay, this is turkey with cheesy exudate in the sinuses due to pasteurellosis. And this one here, what we call as bamboo foot or pododermatitis due to Pasteurella multocida infections in the feed pads of chicken. Okay, the same cases also can be found in turkey and ducks. And this one here, this one is hemorrhages in the intestines here, admixed also with mucus. We call this as mucohemorrhagic enteritis due to fall cholera, in particular acute fall cholera. And this one here, this is the petechial hemorrhages in the cases of cholera in the fatty tissue of heart. And also in here you can see also necrotic part. You can see this whitish part here in the heart. It reflects the necrosis in the heart. And the same necrosis, similar necrosis also can be found in the liver. This one is multifocal necrosis in the liver. You can see there are many pinpoint necrosis foci here. This is what we call as miliary necrosis. This one is the extensive hemorrhages, okay, in the heart and also fatty tissue of the heart and the surrounding tissue as well. Okay, this one is the necrotic hepatitis. Okay, or we can say as the miliary necrotic hepatitis here. The pinpoint necrosis occurs all over the liver lobules. This is the normal heart. This is the affected heart, due to pasteurellosis. You can see here, this is the pinpoint hemorrhages in the fatty tissue and also extensive necrotic foci here, large necrotic foci in the heart. Okay, and this one here, there is also pneumonia. The pneumonia also affect bronchus, therefore we call it as bronchopneumonia, and usually it has a fibrinopurulent types. This one here, this is the fibrins. Okay, and if we found abscess, we call it also fibrinopurulent. This one here, this is cases of pneumonia with many fibrin exudates covering the lung. Okay, we call this as the fibrinous pneumonia, or if it's mixed also with the formation of abscess, we call it as fibrinopurulent pneumonia. This one here, multifocal hemorrhages with degenerations and also perhaps necrosis in the liver. This one here, miliary necrotic hepatitis, pinpoint necrotic foci all over the liver. Hemorrhages in the ovaries. This is also common findings in the case of pasteurellosis, in particular acute pasteurellosis. Histopathologically, okay, here this one is the blood vessel here. This is E means edema, and this one is area of pneumonia, in particular hemorrhagic pneumonia. Within the alveoli, there are many hemorrhages like this here, and you can see also this one is vein, big, large blood vessels with you can see this pinpoint cell here. Actually, this one is lymphocytes, indicating there is vasculitis or inflammation in the blood vessels here. And then there will be also pneumonia in the case of pasteurellosis with many inflammatory cells. Okay, inflammatory cells between the lobuli of lung here, and then there will be this one E means edema. Okay, the space between lobuli will be widening like this, will be widened, okay, with some inflammatory cells in the interlobular septae. And also there are also vasculitis. This is blood vessels with many inflammatory cells around the blood vessels, indicating vasculitis. And then this one here, this is cases of pneumonia. In the arrow here, the arrow pointing a many inflammatory cells. In particular, this inflammatory cells with a polymorphic nuclei and eosinophilic cytoplasm like this, indicating the heterophils. However, there are also some macrophages with also fibrinous exudate within the alveoli. Okay, fibrinous exudate with heterophils, lymphocytes, and also macrophages, indicating pneumonia. And then this one here, this is cases of tubular necrosis in the kidney. Okay, and also formations of thrombus inside the large blood vessels. Here, this one is thrombus. So in histopathology in the liver, we can lesions of pasteurellosis in the liver can be as hepatocyte necrosis, infiltrations of inflammatory cells. It can be a heterophils infiltration, macrophage, plasma cells, or lymphocytes. And in the lung, there will be fibrin or thrombus formations with also inflammatory cell infiltrations. In some cases, the pasteurellosis can be mistaken with salmonellosis, in particular by the lesion in the intestine. Coryza also can be mistaken to pasteurellosis because coryza can cause a sinusitis, cheesy materials in the sinuses, similar to pasteurellosis, and also colibacillosis, which causes hepatitis, will also similar to pasteurellosis, and also staphylococcosis in particular in the case of arthritis. But if there is abscess formations or pollen formations, usually associated with staphylococcosis, or Newcastle disease also can be mistaken to pasteurellosis because Newcastle disease can cause also symptoms of torticollis. The diagnosis can be made from the symptoms, but usually we must perform the necropsy and then we inspect the gross pathology and histopathology as well. To make confirmations, we can take samples from liver tissue, blood, and also bone marrow, and then we can inoculate all the samples to blood agar that already enriched by serum, so the Pasteurella will easily grow there. So for the treatment and control of pasteurellosis, of course, we can give antibiotics, for example, sulfonamides. Of course, to control it, we have to apply strict sanitations and also vaccinations. Usually vaccinations started at 8 to 10 week old chicken, and then we can repeat the vaccination at 18 to 20 week old of age. Okay, next is the case of another kinds of pasteurellosis, but this pasteurellosis only exclusively found in ducks. We call it as Remarella, not Remella, sorry. Remarella anatipestifer infections. We call it as infectious serositis or new duck disease. We call it also as anatipestifer syndromes or anatipestifer septicemia. Mostly 1 to 8 week old are susceptible with this disease, but mainly cases will be found at 4 week old ducks. Besides duck, other species that can be affected is turkey. The incubation time is very short, around 1 until 2 days. The symptoms can be tremor, dyspnea, and low productions. This is the symptoms of a tremor and also torticollis due to anatipestifer infections in the brain here. This occurs in ducks. And the anatipestifer infection also causing cartilage erosions, or we can call it arthritis, in particular in the hock joint. And then cases of anatipestifer infection can be indicate as a fibrinous exudate accumulations in the capsules of liver. We call it as perihepatitis, and also pericarditis. This case almost similar with colibacillosis in ducks. And then, yeah, the similar one, pericarditis, with also fibrinous exudate attached with the surface of the liver, or we call it as perihepatitis, fibrinous perihepatitis, like this one here. Okay, sorry, this one, the same cases. Perihepatitis, fibrinous perihepatitis. You can see sheets of fibrinous exudates attached with the surface of the liver. And this one here, cases of anapestifer infection in Turkey. There will be general weakness and some also neural symptoms that can be found in Turkey. Here, the same turkey with anapestifer infections, okay, develop tremors and also extended legs due to brain damage. And this one here in the turkey, there are vertebral osteomyelitis. We call it a spondylitis in the vertebrae that close to costae, that close to the ribs. Okay, this one here. Usually, besides necrotic tissue, we also found some abscess. Okay, if we cut, we can see here there is extensive bone damage here. Okay, there will be liquefactions of the bone tissue. So the bone tissue will look damaged, and also some will be liquefied, okay, due to extensive necrosis. And yeah, I just summarized the gross pathology can be as serosal inflammations, serosal fibrinous inflammations. It can be found mainly in pericardiums, lungs, in particular in pleura, meningen, and also liver. And histopathologically, there will be fibrin and inflammatory cell infiltrations. This case of anapestifer can be mistaken. It means it has also differential diagnosis. It can be mistaken with cholera cases, maybe colibacillosis cases, and salmonellosis, and also Newcastle disease. The treatment for anapestifer is similar with fall cholera. You have to apply antibiotics, in particular sulfonamides. And in the case of flock or farm that already affected by this anapestifer infection, we have to also apply a vaccination in DOD. DOD means day-old ducks, 1 day old ducks, by using spray vaccinations. Okay, this one here, perihepatitis, fibrinous exudates in the surface of the liver. In the case of colibacillosis, really looks similar with anapestifer infections. The same perihepatitis here and pericarditis. Similar cases found as the anapestifer. So to distinguish between colibacillosis and anapestifer, sometimes we have to also perform isolations from the tissue samples. Okay, this one here, swollen bile. It makes the liver looks green. Colibacillosis can cause the similar disease, similar lesions, but also salmonellosis. So, okay, this is the summary of the disease in poultry. Okay, so for examples, factor carriers that carry out the disease or reservoir of infection can cause infectious diseases. Okay, and then all the disease caused by infections of the body tissue due to all these infectious diseases. Therefore, for infectious disease, we have to apply for strict biosecurity. Okay. Besides the infectious disease, there will be also non-infectious conditions like poison, injury, stress, nutritional problems, or poor housing management. All of these factors, we call it as predisposition factors that may makes the animals more susceptible to infectious diseases. Therefore, why the biosecurity is important is also to make this predisposing factors or predispositions can be managed well. Okay, so that's all for today's lectures. Okay, this is yeah, some words from the lecturer to you. So with study, hard work, perseverance, honesty, and prayer, success will be achieved for you. Okay. Thank you for your attentions. Have a nice day, and until we meet again in another lectures. That's all. Thank you.